Next, we'll hear from Lauren Ellis, who is a health researcher who recently completed her PhD in health policy and bioethics at the Johns Hopkins School of Public Health. Dr. Ellis has conducted research and policy evaluation in academic, government, and quasi-governmental settings. While working as a program associate for PCORI, Dr. Ellis helped to design and implement a longitudinal survey evaluating stakeholder engagement across PCORI's research portfolio. Her dissertation involved qualitative interviews with the PCORI-funded investigators and patients to characterize patient engagement in PCORI-funded research. Dr. Ellis has research interests in stakeholder engagement, comparative effectiveness research, research ethics, and regulatory science.
Great. Well, thank you all so much for having me here today. I'm going to be sharing some of my findings from a qualitative interview study I did with PCORI-funded principal investigators and the patients that they were engaging in their research. So I know many of you here today are familiar with PCORI, but for those of you who may be less familiar, I just want to provide some background information. PCORI stands for the Patient-Centered Outcomes Research Institute, and it's a large nonprofit research funding organization that was congressionally authorized under the new healthcare law to fund comparative effectiveness research, so research comparing two or more treatments to each other. And PCORI actually requires patient and other stakeholder engagement in most of the research it funds. So this means that researchers are actually required to involve patients in their research in ways other than just as subjects of research. So this can include having patients as advisors or co-investigators or just soliciting patient feedback over the course of the research. So it really is an umbrella term for a lot of different activities that seek to involve patients in a more active role in research. And PCORI has really made a large investment in not only comparative effectiveness research, but also in patient engagement because it has this requirement. So it really presents itself with a great opportunity to look at patient engagement and see what we can learn from this model of having patients take on a more active role in the research process. So that's what led me to my research project, which was the qualitative interview study. I wanted to know how patient engagement was operationalized in PCORI-funded projects. And I had a couple different aims. One was to really characterize patient engagement in these projects, including how, when, and why the patients were engaged in the projects. I also wanted to describe some of the challenges that these sort of early initiators of patient engagement in PCORI-funded projects had experienced. And then I wanted to document the effects of patient engagement. So what was different as a result of patients being involved in these projects? So I'm going to just go over my methods really quickly, but I'm happy to answer more questions about it as we go. I used purposeful sampling from PCORI's earliest funding initiatives, and this included the 50 pilot projects and the 25 Cycle 1 awards. And I reviewed the funding applications and then built a sample of projects to include typical engagement approaches that were described in the funding applications, while also capturing variation with respect to several other characteristics. So I wanted to make sure I included projects that were engaging different kinds of patients. I also wanted to include some projects that were engaging non-patient stakeholders in addition to patients like physicians or policymakers. And then I also wanted to include both projects where the researchers knew the patients prior to engaging them and projects where the researchers didn't. And once I had identified the projects that I wanted to include, I then approached the principal investigator and asked if they were willing to participate in an interview with me to tell me about their patient engagement component of their projects. And I asked them if they were willing to have patients who were engaged in their projects also participate in an interview. So this allowed me to do interviews with researchers and with the patients engaged in those same researchers' projects. And then I conducted the interviews and transcribed and audio recorded and transcribed them, and then used a combined deductive-inductive approach to analyze my qualitative interview data. And I also enlisted the help of a second trained coder to assess the reliability of my coding scheme. So I know that was just a little bit of my methods, but I want to make sure I allow enough time to talk about my results. So I'm going to share with you today a little bit on the participants, the approaches that the projects used to engage patients, some of the challenges that were reported, and then I'll spend the most time on the main effects of engagement that researchers and patients reported. So this slide just provides some background information about my participants. In total, I conducted interviews with 19 investigators from 19 different PCORI projects, and then also with 33 patients from 18 of the same 19 projects. And you can see that among my investigators, about half were female, most were white, and about half reported having prior experience engaging patients in their research. Among the 33 patients, most were female, white, and pretty highly educated, and about 1/3 had prior experience participating in patient engagement activities for research. This table depicts the types of engagement approaches that were used by the projects in my sample. You can see from the very bottom of the table that it was common for projects to use more than one approach to engage patients. So lots of projects were doing multiple things to work with patients over the course of the project. Advisory groups was the most common approach to engaging patients, and this typically included researchers meeting with patient advisors or multi-stakeholder committees and providing feedback on the project as it was going, progress updates, discussing key topics, and then requesting feedback on certain areas. About half of projects actually engage patients as co-investigators or research team members, and these patients were really involved throughout the course of the study. They met with the research staff on a regular basis, and sometimes the co-investigators even led other patient engagement activities, like they might chair the patient advisory board in addition to being a patient co-investigator. About half of projects engage patients in pilot testing, study interventions, and materials. So these patients provided feedback on materials prior to them being administered over the course of the study. And then less commonly used were focus groups, interviews, and surveys, but these typically involved single interactions with patients to get feedback in a very targeted way. So it might be a survey asking patients to rank study outcomes of greatest interest or something like that. And then a few researchers developed their own approaches to engage patients, including an online discussion board or an interactive workshop with patients and physicians working together to design an intervention, for example. There were a number of challenges that both researchers and patients reported. Sorry, I know the font is kind of small on this slide, but these really fell into two categories. The first were logistical challenges, and this really referred to challenges relating to planning and organizing patient engagement. Researchers faced institutional barriers in working with their universities and working with institutional review boards who didn't always understand the role of an engaged patient as something different than a subject of research. Researchers also struggled to schedule meetings, especially when multiple stakeholders were involved who had conflicting schedules. And over half of researchers articulated that they really did not fully anticipate the extent of work that was required to engage patients and to do it well. And so they realized not only did it require upfront planning, but also planning on the back end to incorporate patient feedback. And it was hard to budget for that time in advance. Aside from the logistical challenges, researchers and patients also talked about more substantive challenges related to the engagement activities themselves. Both researchers and patients talked about challenges related to selecting patients, finding patients appropriate for engagement, finding representative patients, the struggle between whether or not researchers were seeking a lay patient who didn't have any medical background versus an advocate who had more training but might have an opinion about something coming into the project. Researchers also talked about challenges to orienting and educating patients, especially when it was a patient who didn't have any research background. They felt that those patients needed a fair amount of orientation to be able to participate in engagement and give constructive feedback. And then some researchers, particularly those who were new to engagement, didn't really know when or how to engage patients in their research. So they struggled and kind of had some trial and error to figure out what was best in engaging patients. And last, a few researchers talked about challenges related to incorporating patient feedback. So sometimes researchers felt that the feedback was not scientifically appropriate. It could compromise, the validity of the study, for example. And then in other cases, they simply didn't have the time or resources, or it wasn't feasible to incorporate patient feedback. So they really struggled with how to be responsive to the patient advisor's feedback, even when they couldn't actually respond to it in the way they would have liked. But despite these challenges, there were a number of effects of patient engagement that both researchers and patients reported. I'm going to walk through each of these and share some quotations from my interviews. So the first effect of patient engagement that was reported by both investigators and researchers was enhanced relevance of the research to patients. And this was not only the most common reason for engaging patients in the projects, but it was also the most common outcome of engagement. And this included patient input resulting in changes or tweaks to the research questions being asked, to instrument items, including the wording of questions on surveys and interview guides, also the domains included on surveys to include topics that patients felt were important. It also included changes to the study intervention. So some researchers asked patients, what would you want to see in this intervention, and then made modifications based on that feedback. And then in some cases, it included changes to study outcomes, like the addition of secondary outcomes that patients identified as important to them. And this quotation talks about this. The investigator says, "We clearly needed to have very active engagement with patients to find out what they thought were important outcomes. We were not assuming anything was important to them." So in that case, the investigator actually had the patient advisors pick what outcomes were most important to them. And not surprisingly, that was different than what the physicians had identified as the most important outcomes. Another outcome of patient engagement was enhanced feasibility. In this case, patient input was used to anticipate problems or look at how to solve roadblocks. And this resulted in changes to recruitment plans, study materials, in some cases, the study intervention. And really, when patients were able to pilot test materials, they could give feedback on what works and what doesn't work, and then researchers could make changes from that feedback. And this investigator says, they really challenge you to think about, how does this come across when you're offering this to a patient? Is this feasible? Is this practical? Another outcome of patient engagement was improved appropriateness of the research. And this occurred when patients gave input on study methods and materials, which sometimes resulted in changes to those methods to make them more acceptable or appropriate to patients. In one case, for example, a researcher changed from using a focus group to collect patient data to using individual interviews because the patient advisors felt that patients in the study may not feel comfortable talking about sensitive health information in a group setting. So those kinds of changes to make the study more acceptable to patients. And this quotation is actually a parent co-investigator talking about how the researchers engaged patients in designing an online component for the study. She said, "That involves actually my son, who has the medical condition. That involved him meeting with the researchers and saying, well, this is how I would feel comfortable communicating online. This is how I wouldn't be. And then going to our families and saying, how would you feel comfortable communicating online?" And then last, some researchers and patients talked about how patient engagement actually improved the overall quality of the research. Researchers tended to link this to other outcomes of patient engagement like relevance, and I think this is actually best exemplified in the quotation, so I'll go ahead and read that. The investigator says, "You're going to come up with a better design for that survey if you're engaging patients. I'm old enough to have seen the old method of doing this." Oops. Something's going on, which is where the professors come up with the survey and then watch people either not fill it out or give you invalid data because it's, from their perspectives, stupid questions or questions that are not really relevant or understandable to them. So I know that was a little whirlwind on my results, but I do think that this study provides insights into the nature of patient engagement, some of the challenges that researchers and patients have faced, and the main effects of patient engagement. Across the 19 projects in my sample, there was a fair bit of variation with respect to what approaches were used to engage patients, how often researchers and patients met, and the extent to which patient input actually changed the research. But both researchers and patients did report several effects of patient engagement, including enhanced relevance of the research to patients. And I know I only briefly touched on the challenges to patient engagement, but I do think they're important to mention because they point to several actions for consideration that I think several actors, including researchers, funders, and institutions, can and really should take to sort of bolster the infrastructure for patient engagement. And I see these as really low-hanging fruit, like more training opportunities for researchers to learn how to engage patients, or networks that could link researchers and patients together because researchers struggled to find patients to engage, and sharing resources and developing policies at the level of the institution to remove some of that red tape, around IRBs and other issues that arose. There were a few limitations to this project that I'll highlight very quickly. It only included PCORI studies, which might limit the generalizability of my findings. The investigators that participated may have been different than those that didn't participate in interviews, but I do think they were the same on several characteristics. And I couldn't assess engagement at later stages of research, particularly around dissemination, where there's a lot of interest in patient engagement. But despite those limitations, I think these findings provide emerging evidence of the effects of patient engagement, and they suggest that patient engagement can successfully enhance the relevance of the research to patients. And so if we want to see continued success for patient engagement, I think we need to continue to support patient engagement in research. So With that, I'll go ahead and stop. I know I'm out of time, so thank you all very much. I look forward to your questions.